How you doing today? This is Matt with the Center for Life Support here at the Children's Hospital of Philadelphia. Today we're going to talk about your adult airway station. So the first thing I'm going to talk about is the two different bags you can find in your code card. Your blue bag, your amber bag, your self-inflating bag. If this bag is not hooked up to oxygen, it can deliver 21% room air. If it is hooked up to oxygen, it can deliver near 100%. Second bag we're going to talk about is your Mapleson. So your Mapleson bag, this needs flow. If this bag is not connected to flow, it's not going to flee. You're not going to be able to give ventilations to your patient. These two bags you would find in the orange airway drawer of your code card. Next thing we're going to talk about is your airway adjuncts. So you have oral airways and you have nasal airways. So these you would find in your orange airway box, which is next to your code card. So the first thing we're going to talk about is our oral airways. So oral airways, we use these for patients that are obstructing their airway, they're not protecting their own airway. The way to measure these, corner of the mouth to the angle of the jaw. Then you can take your tongue depressor, displace that tongue down and out of the way, and insert this straight in. Once you do that, you'll be able to ventilate your patient more easily. So contraindications for your oral airways are if your patient's awake or if they have an intact gag reflex. So if they are awake or have an intact gag reflex, you cannot use those. Nasal airways. So nasal airways, you're going to measure from the corner of the nose to the tragus of the ear. Before you insert these, you're going to lubricate them with your lubricating jelly, not including that distal tip. So you can put these in the right nostril, left nostril, it doesn't matter. If you look at it, there's a bevel on it, so they're actually designed for the right nostril, but again, either nostril works. Once that's inserted, it's going to sit flushly on the nail like so. Now you can go ahead and start ventilating your patient. So if your patient has a heart rate but is not breathing adequately, we're going to do rescue breathing. So rescue breathing on an adult is one breath every 5 to 6 seconds. You want to make sure you make that good EC technique. So you get high up on the mask and make that C, these two fingers on the jawline. Tilt that head back and give breaths. 2, 3. Now if your patient's intubated, and you have CPR in progress, you're going to do continuous CPR with one breath every 6 seconds. So let's talk about intubated patients now. So if this patient, they're intubated, they're on the ventilator, that vent starts alarming. So thinking about that vent, it's alarming. What mnemonic can you guys use to help you understand or figure out or troubleshoot what's going on with your patient? So there's that DOPE mnemonic. DOPE mnemonic stands for displacement, obstruction, pneumo, and equipment. Easiest one to rule out right away is going to be your equipment. So you're going to disconnect your patient from the vent and you're going to start bagging them. So this patient's intubated, we're ventilating them. So if I'm ventilating them and I can't ventilate, I'm not seeing chest rise, my ET tube can either be displaced or it can be obstructed. If I am ventilating and I do see chest rise and it's uneven, it could possibly be a pneumothorax. So that would be your quick mnemonic to help you understand or just troubleshoot what's going on with your patient that's intubated and not able to ventilate. All right, guys, so that is your adult airway station. Thank you guys for watching.